name is Alan Yetzi. I'm a family practitioner here in Hillsborough County, Florida, and have been in practice for about 25 years now. With MGSI, I believe we first started to work with them about 16 years ago. To understand the services that MGSI provides, I think you have to understand what has happened to healthcare and why there's a need for a service like MGSI. When I first started in practice, it was a fee-for-service world, and patients paid for the service they were provided. Shortly thereafter, insurance companies and HMOs, as we know them, changed the payment mechanisms and the way the management of healthcare was provided. And to keep up with that, you needed a more sophisticated system. The need for MGSI and the services included everything from billing and collections to systems that were needed to achieve those billing and collections. Somewhere in the late 80s, early 90s, Medicare and other companies started requiring electronic submission of claims. So small offices, again, could buy proprietary software that needed upgrades and other yearly tweakings to keep them running, whereas a service like MGSI, it was all inclusive. It's that whole continuum of service that was needed to keep the practice ahead of the curve. MGSI has improved patient care by allowing the practitioners to focus on patient care and not worry about the financial state of the practice. Knowing how you're doing on a month-to-month basis using the reports that are generated through MGSI gives you the ability to keep your finger on the pulse of the practice. Technology allows you to have those systems, which keeps you up to date, and with the contract with MGSI, upgrades in those technologies are their responsibility. When you can trust in a company to oversee that process, then you're less burdened. Their ability to generate reports that will identify claims that need additional work, that need to be resubmitted, but now instead of 3 months, 6 months, we're talking about a day or 2 days, and reports that clearly identify what patient, what's missing, what needs to be added to be resubmitted. Prior to that, those reports could sit in a drawer on somebody's desk and never be seen again. If you're not profitable, you're stressed. And if you're stressed, you're not focusing on patient care. Ultimately, the patient suffers, ultimately, patients leave your practice, and ultimately, the practice dies. So, how do they help? They help keep me focused on patient care, quality of care, the employees focused on patient and customer satisfaction. Training is always available. The staff of MGSI is professional, well-trained themselves, and in doing that are able to train new employees that come on to the practice or bring new information to the employees as upgrades and so on are being done to the systems, which is constantly being done. So the access to MGSI staff is just a phone call away.